Hello and welcome. Thank you for joining us today in our session on the emerging areas of behavioral science application across the UN, another session of UN Behavioral Science Week. So for those of you who don't know who I am and haven't seen me at sessions yet, my name is Mary McLennan. I'm the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. I also am the lead of the UN Behavioral Science Group in the UN Innovation Network, which I will come to shortly. So I first wanted to begin with a bit around UN Behavioral Science Week. So here we are on Wednesday. We still have 2 more full days of events for you to check out, from topics with respect to artificial intelligence, health, how to improve knowledge sharing and information. So there's lots more still to come. But today's session is really going to give us a tour of a lot of different areas of UN application and reflections when it comes to behavioral science. So as I mentioned, I lead the UN Behavioral Science Group, which is an initiative of the UN Innovation Network. It brings together over 1,000 UN colleagues from more than 60 entities in 110 countries. It's quite a diverse group. We have colleagues who are working obviously all these countries around the world, different contexts, also on topics ranging from health, climate, gender, peace and security, and across a range of experiences with behavioral science as well. So although we do have some behavioral scientists in the UN, and we'll speak to a few of them today, many of the colleagues in the group are at the early stages of their journey. So no matter where you are along that spectrum, there's a space for you. And you can also join the UN Behavioral Science Group if you are outside the UN as an observer. So we have observers from governments, international organizations outside the UN, civil society, academia. So there are lots of people outside who can join us in our discussions about behavioral science and progressing it across the UN. And I'll share the link to UN Behavioral Science Week and the UN Behavioral Science Group in the chat when I'm done sharing slides. So in addition to the Behavioral Science Group, we also have a number of strong signals of support from senior individuals in the UN. None other than the Secretary General himself has come out to call behavioral science a critical tool for the UN to progress on its mandate, and also strongly encourages entities to work together and to invest in behavioral science, which is what we aim to promote in the UN Behavioral Science Group. So with that, if you're interested in more about behavioral science in the UN, there are a number of documents you can read, including the Secretary General's guidance note. There's also a report and a practitioner's guide to getting started. So again, I'll put those links in the chat if you would like to explore. You can also join the UN Behavioral Science Group, as I mentioned, and again, the link will come shortly. And then you can also follow us on Twitter if you want a more real-time update on what's happening. Okay, so enough about that, on to our content for today. So as you can probably tell, we have disabled the chat, but what you can do is you can put your questions in the Q&A box. You can also upvote the questions of your colleagues. So please keep an eye on the Q&A box. We have a large number of presentations today, so I'm sure you'll have lots of different questions, and it's a good space for us to keep note of those, as well as to understand where the audience is in terms of their interest in the topics, the wide variety of topics that we will explore today. Okay, so how today will work is we'll have 3 presentations from these colleagues here. First from John Burkhart, who works with the IMF. Second from Debbie from the UN Department of Global Communications. And then thirdly, Kunal Sen from the UN University, UNU Wider. I'll allow them to introduce themselves and their work throughout their presentation, but just to give you a bit of a heads up, after John, Debbie, and Kunal, we will have short remarks from these 3 colleagues here about their experiences in the early stages of behavioral science understanding and possibly working towards applications. So first we'll hear from Christelle Demar from ICAO, then Sonia Gario from UNESCO, and finally Katarina Kwai from DCO. Okay, so with that, I'm going to stop sharing slides and turn it over to John to kick us off with a presentation. Over to you.
Thank you very much, Mary, and welcome everybody. Thank you for joining us today. I'm going to go ahead and quickly share my screen. Hopefully this will work. If you're not seeing the screen, please, Mary or somebody, give a holler and let me know.
You're good.
So, as indicated, my name is John Burkhart. I am here today on behalf of the International Monetary Fund. Now, an interesting wrinkle, I don't actually work for the International Monetary Fund. I am, by training, a recovering professor and currently head up Capita Solutions, an applied behavioral economics and neuroscience agency. We have been embedded and integrated with fund operations for about 2 years now and have an ongoing relationship with them that extends even longer. And I want to talk a bit about what that looks like, because it explains a great deal of how we approach employing behavioral science in IMF work. There we go. Okay, cool. So at the fund, behavioral science is largely contained within one department, that being the Creative Solutions Group. Creative Solutions historically is the human-centered design laboratory at the fund. Going back as far as 2018, 2019, the higher-ups in the Creative Solutions Group recognized the importance of integrating applied behavioral science with human-centered design. And that is the point at which Capita Solutions, the agency which I directly represent, came to start working and collaborating with the fund. And this has a lot of advantages. It means that the fund has a self-contained BeSci unit where expertise is cultivated and developed, and everybody within the Creative Solutions Group has at least a layman's understanding of how to approach and employ behavioral science. Beyond that, there is a great deal of specific expertise. Capita employs people from academia, practitioners, so that when there's a need for focused investigation and focused projects, we can have a collaborative effort that where the whole is much greater than the sum of the parts. And we've worked on a number of topics over the years. Return to office, which we'll discuss in just a moment here, looking at how to improve charitable giving, how to improve product launches and generate adoption of novel products, looking at how to facilitate adoption of digital currency in emerging economies, all manner of different projects. But as I said, I want to focus today on the returning to office in the post-COVID era. This obviously is something that's very topical and relevant. Back in 2021, the fund faced a challenge, which is HQ had been empty for over a year. The fund had actually increased its headcount substantially, and it was necessary to bring everybody back into HQ in a safe fashion. Now, this was the task that was laid out to the Creative Solutions Group. What we ended up doing is looking at what are the actual behaviors that then underlie this particular challenge that's before us. So then looking at this, the behavioral challenge was actually, how do we drive widespread adoption of novel ways of working in employees who have well-entrenched work habits? The typical fund employee has nearly a decade of tenure, so these habits are very strongly entrenched. And what we were trying to get them to do, the new behaviors, were not intrinsically reinforcing, they were not easier, and there was a great deal of inertia working against them. And this was all, of course, in the context of phenomenally inconsistent background messaging in terms of what had been put forward by WHO, CDC, various government agencies. The messaging around COVID and healthy, safe practices had been very inconsistent. Interesting sidebar, this is a case study that I use in my class where we're looking at how do you botch risk messaging? And that's basically, COVID is a beautiful case study in that. How we approach this was, of course, the first place to start is workplace communications. This is the first place that everybody turns. Messaging, emails, signs. And this is all well and good, but we can't just do that. Nevertheless, we need this to be good. So we didn't just want signage. We wanted signage that would speak to the people to whom it was most relevant, and that would be located in places where it would be seen when it was relevant. We looked very specifically at sensory apperception. You can have a great message, but if people's eyes and brains don't notice it, so what? So then we looked at what ways can we actually trigger the retina so that signs are attended to and then processed, and use continuous redesign to make sure that novelty never wore off. Looking to align behaviors to the lowest barriers to compliance. That is to say, when you're trying to change behavior, some asks are just bigger than others. And if you start with those, you get a lot of what's called reactance, a visceral negative response to requests that are seen to undermine personal agency. So then how do we align people to the simple things? And then once they are then aligned to simple things, how basically they become, their identity becomes more coherent with where we want them to go. It becomes easier to move them towards those big asks. Linchpin theory. We know that at the fund and really at every large organization, there are certain individuals who exert disproportionate influence on the rest. So we went about mapping these informational and influence networks. What individuals actually convey the greatest degree of influence on the fund writ large, and intervene in these individuals first, so as to function as a bit of a influence multiplier for the rest of the fund. And then a phased re-entry approach. This is what we call a low density intervention. Bring people back not all at once, but a small group. initially for the first 3 to 4 weeks. And those people who we've determined to be most susceptible to positive intervention, those who are most likely to adopt these novel behaviors, so that once they have adopted these practices and people come back, they can serve as a target, a model for the social gravity of those who are then returning to the office. There's, of course, a great deal more to it, but we have a really short time window here to discuss. Happy to please reach out if you want to learn any more about what specifically went on. But the lessons we took from this were that basically there were 0 cases of COVID that occurred at the fund HQ in basically the time since. So this means that we can accomplish behavior change at scale. This is something that is always a bit of a question mark. Is this actually possible, or is this window dressing? No, it's real. We've been able to demonstrate that it's real. Messaging in isolation is insufficient. You can't just message your way to behavior change. You need to look at the surrounding constraints, attentional issues, making sure that cognitive load and cognitive processing is such that whatever you're trying to get people to do is going to align or be processed in such a way that they are able and willing to then undertake these novel behaviors. And to that point, disrupting habits requires multiple ways of engaging the audience's brain. Habits are driven by midbrain circuits. They are not driven by conscious processing. They're much more primitive and therefore very difficult to subvert. Therefore, if you don't have some means of genuinely constraining choice, the only way you can accomplish disruption of habits is by engaging multiple points of influence in a cumulative fashion to create that behavior change that you want. And I will stop here because I've been going a bit long, and pass it off to, I believe Devi is up next.
Hi, everyone. Just bear with me so I can open up my presentation. Just hold on a second, please. I hope everyone can see my screen. Hello, everyone. My name is Devi Kalanivelu. I am from the Department of Global Communications. I'm not a behavioral science expert, but I've been in communications for a couple of decades now, and I was part of this big team of communicators and partners in 2020 when we launched the Verified campaign, which is a flagship campaign of the Department of Global Communications at the UN Secretariat. It was really quite revolutionary and instrumental for us in the way we communicated on vaccine communications, urging people to understand more about what was happening around them during those critical years, and to also bolster the intake of vaccine and to keep safe and during that time. So Verified, a partnership between our department and the social mobilization company called Purpose, whom we have partnered with in various other issues such as climate and all that. We partnered with them to launch Verified in May 2020. To basically, the ultimate priority was to deliver timely and accurate life-saving information, fact-based advice, and stories of human solidarity. It's a campaign that looked at vaccine and misinformation hesitancy through, the lens of social norms to ultimately encourage behavior change. We wanted to create and spread compelling and accessible data. I mean, all our content came from our trusted partners and messengers from the World Health Organization and across the UN system who are heavily engaged in the COVID response. We wanted to help build information literacy. We wanted to encourage vaccine confidence. We wanted to promote global solidarity and a fair recovery from the pandemic. So we basically realized that, we cannot successfully tackle the pandemic without also addressing the misinformation that was really coming at us with such vigor at that time, and to ensure that people everywhere had access to trusted information and trusted messages coming from trusted messengers, so they can be empowered to make the right health decision for themselves, for their families, for their communities, in their countries. So Verified is a massive campaign that we see it more of an ecosystem that actually has the different sub campaigns within Verified that focus on the different target audiences, the different techniques and techniques that communications we can use to influence behavior. So we employed many different tools and tactics. One of the first things that we did was to establish this pool of information volunteers. So we wanted to empower people to do something good during this time, to share the right information from trusted sources, to look out for their community, to think about the information that they were receiving, to question the information, and to see if it was safe or not to share it with the rest of their community. So we started this, and it quickly became quite a hit, if I can say so. We had like hundreds of people joining us. They were receiving trusted information on a daily basis that they were able to share on their social media platforms. We created really attractive and compelling and very easy to understand and read graphics and content that you can share on social media. And we basically asked our information messengers, the volunteers, to share this information with their communities. And another campaign that this group may be interested in is called Pledge to Pause. And Pledge to Pause was it's basically we asked people to think before they share the information, to pause to check whether the information is valid. It was basically, we thought that it was very effective at introducing a behavioral science application or behavioral science aspect to reducing the share of misinformation. And during that time, there was a research group at MIT that conducted a randomized controlled experiment testing the behavioral change impact of pause and content in about 16 different countries. And the study showed that the exposure to the content significantly reduced participants' propensity to share fake headlines with the degrees of about 10% on average, compared to with higher rates in places like India and South Africa and the US. And India and South Africa are two places where we actually had like nationally focused campaigns as well. So there was a large amount of push in those places. So, through pause, we believe that the simple act of pausing to question the origin, the credibility, the relevance, the accuracy of any information that you share on your phone, be it WhatsApp, on your social media platform, significantly reduced people's propensity to share misinformation. And at the end of 2021, the campaign reached over 1 billion people, including 3 million on social media, collaborated with about 250 plus organizations and distribution partners in 60 countries. And for that particular campaign, we produced about 2,000 different pieces of content in 60 languages with the help of 70,000 information volunteers. And all this happened in a year and a half after Verified was launched. And another aspect of Verified was another sub-campaign called Only Together. And Only Together was also about, forming the solidarity, during times of crisis, bringing people together for the collective good, so we can recover from the disaster that we were facing. And this, we also thought, really helped people to come together, and particularly in areas where we had like these very national focused campaign, where we could actually go out and do our outreach and to work with community leaders and work with community focused organizations to tap into an audience that we would otherwise not reach as a massive organization. And then another aspect was also another thing that was really interesting as part of Verified was we created Team Halo. Team Halo is basically a group of scientists and healthcare professionals who have voluntarily joined this particular community. to directly communicate with the general public, to their audiences. So we actually, Purpose, the company that we were working with, actually, enlisted help from some major influencers on social media to train these professionals who are working on the vaccines, or working as healthcare workers, to use those platforms to communicate their work and to communicate the effectiveness of vaccines and the importance of keeping safe. And which is still an initiative that exists today. And it's still, a community-based initiative, and it's growing. We have healthcare workers from many different parts of the world who are part of it. Team Hello. So, I mean, I know that I'm running out of time, so I'm just going to go through a couple of things that we learned throughout this process when it comes to Verified. Our biggest lessons were that, we need to meet people where they are. We need to go to them. We need to tap into the communities that they belong to. We need to speak in their language. We need to be very careful with the nuances and the expectations and so on. And another big thing that we learned was to strike first with the information, to proactively, share information, accurate information, and to strike often, to expose people to the accurate information again and again through different ways, on different platforms and different languages, and so on. And, I think one of our biggest challenges was to find ways to break through the saturated media environment. And we had a lot of interesting little campaigns that we did. For example, in Brazil, with research, we found out that young people in Brazil underestimated COVID-19 and weren't very responsive to the official communications, which, and then 2 years basically into the pandemic, they had been exposed to a lot of COVID-19 messages, but were not really paying attention to it. So what we wanted to do was to take them, go to places where they would be. For example, we had a campaign that was focused on dating safely. So we partnered with Tinder in Brazil to basically talk about the importance of being vaccinated, to go back to normal life again, to be safe, a safe date with someone who is also vaccinated. So that was one example. And in India, for example, we used a lot of community leaders to go out into particularly in communities that were hard to reach, that were not, governments were not doing enough or could not do enough to reach the communities, remote communities, and so on, that did not have access to this kind of information and did not know what was happening around them. So we enlisted community leaders, community medical workers, people, trusted messengers, people in the community, the people in the community trusted, basically, to go out and encourage them to share this information. And we did, with the studies that were done, and I do not have the number, but, we did realize that it did change the way people, it did increase the number of people wanting to know more and wanting to get vaccinated and wanting to, keep themselves and their families safe. And we also had another campaign in South Africa, and sorry, this will be my last share. It was basically an initiative to promote mask wearing and vaccination, particularly in the townships in Cape Town. So behavioral science research told us that we needed to increase people's risk perception, the feeling that there's threat to themselves or their loved one, while also empowering them to feel like they can do something about it. We did focus groups. We listened to a lot of young people. There was a lot of concern about, they were very concerned that their older family members, were getting sick or were getting exposed. And so we basically said that, do it for somebody else, do it for your family, do it for the people you love, do it for your community, and so on, just kind of like empowering them to take charge of the response, basically. And I think I will stop right here, since I've taken up quite a bit of your time, and happy to take questions later.
Thanks for that, Devi. Over to you, Kunal.
Right. Thanks, Mary, for inviting us to speak in the UN Behavioral Science Week. Let me just first share my slides. Hope it works. Okay. Can you see my slides?
Yes, perfect.
Great. Okay. So I'm Kunal Sen, the director of UNI-WIDER. UNI-WIDER is the World Institute for Development Economics Research. So it's part of the United Nations University. We've been in existence for 35 years, based in Helsinki, Finland, and we're a development economics think tank. So a lot of what we do in UNI-WIDER uses behavioral economics in very different settings. I'm going to speak about one specific particular example of what we do, but there are many other examples that we have on our website of using behavioral economics. So the particular question I'm going to look at is, how can behavioral science improve better governance at the local level? So to provide some background and context, we've seen in the last several decades now, developing countries going through recent waves of decentralization to counsel failures of democratic participation and so on. And by doing so, try to increase people's participation, improve accountability, bringing governments closer to people and so on. Now, that was the ambition of political decentralization, but in reality, that hasn't worked in many different contexts. And so in spite of these efforts to decentralize power to the local level, we've seen bureaucratic inefficiency, office holder misconduct, and other institutional weaknesses, which has essentially led to a situation where there's been a lot of cynicism about decentralization. Now, one way to handle this particular problem of how do we think about local leaders, elected leaders, how do they function, is you can think of costly monitoring of these leaders. You can do monitoring incentives as a standard ways economists think about it, to help align the conduct of office holders with the interests of the local citizenry, so the voters. But of course, that's, in practice, it's very difficult. Public purse constraints makes us seems less feasible. They're very expensive and very difficult to run. So what we want to see is that, okay, we have a challenge. Decentralization is a good thing, but we also see some challenges and some issues to do with how local level officials behave. And we know that standard approaches to fixing this problem is not really going to work. Can we try to combine orthodox incentives with behavioral insights to provide a more suitable alternative? So how can behavioral economics help us understand how to make local level governments function better? That's the question. So what we're going to try and do is report on new experimental evidence on how local politicians and non-politicians, we want to compare these two groups, behave and respond to institutional incentives. And I'll speak a little bit now about what these incentives are. And the work has been carried out by UNI-WIDER, as I mentioned. We have a website which has all the different papers from this particular project, and I mentioned that at the end. So what we do is we build in three key features of the institutional environment we see at the local level in many parts of the developing world. First, we look at the degree of anonymity in the interaction between politicians and citizens. Second, we look at the visibility of transparency of actions of politicians. And third, we look at the process for upfront promise. If politicians make promises to their citizens, then what does it really imply for citizen welfare? And we argue that this kind of incentives capture a lot of the kind of issues we see at the local level among local politicians in decentralized settings, low-income countries. These are kind of features we tend to see quite a bit across local politicians, elected local politicians in many local low-income countries where we have political decentralization. So three institutional incentives or environments. First is, does it really make a difference if politicians interact face-to-face with citizens? In other words, if they tend to see each other on a regular basis through meetings and so on, does it really matter? Second, does it really matter if politicians are when they see the actions are being more visible to citizens? So are politicians more generous when the actions are more visible to citizens, to non-politicians? And thirdly, promise making. Do politicians keep their promises and show more generosity when they have to make an upfront promise to their citizens, to their voters? So these are the three things we want to try and capture in a behavioral economic setting. So what we do is we run modified dictator games. with 311 elected politicians from village councils and 218 citizens in 2 states of India. Now, why do we have also non-politicians? Because we want to compare their behavior. We want to make sure that what we're seeing is not just true for all individuals in this context, but specifically true of politicians. So that's why we have a situation where we're looking at both politicians and non-politicians, and we're running the dictator games with them. What are dictator games? In a dictator game, the dictator could be a politician, could be a non-politician, essentially decides how much to allocate of a given endowment, say $1,000, between themselves and to a recipient. And the recipient, either they can see face-to-face or could be anonymous. And we'll look at these different treatments. So that's a modified dictator game. You're going to play with 300 elected politicians from village councils in India. So the village council in India, called Gram Panchayats, are the lowest level of governance in India. It's absolutely the lowest level, but very, very important for public goods delivery. They handle big programs nowadays in India. They deliver major public works programs, schooling, health clinics, and so on. So they're really, really important for the citizens in these villages. What do we find? We find first that politicians become significantly more generous when interactions are personalized. In other words, if you compare 2 situations where politicians don't know who's receiving the endowment that they decided to allocate to the other person versus when they tend to see each other, we see significant difference in generosity when they tend to see each other. But remember, what we've done here is we've paired politicians and non-politicians. And the non-politicians are taken from very different villages, so they don't know each other. The first time they get together in the situation, they don't know each other, and then they decide how much they need to allocate to the other person. So what we find is that when interactions are personalized, when there are more face-to-face meetings, politicians become more generous. Second, very interestingly, politicians keep their promises much more than non-politicians, and they're likely to give more than citizens. So when you compare politicians and citizens, and we have this sample of both groups in our behavioral economics setting, we find that politicians keep their promises and also are likely to give more than non-politicians. Thirdly, and counterintuitively, we find they do not respond to greater visibility more strongly than non-politicians. What that means is that we play a game where the actions they are taking sometimes are not due to their own action, so not could be because of nature. So we have a situation where politicians are giving, but the non-politician receiving the money is not sure whether it's a politician who's taken the decision or whether it's nature. So we do it in such a way that the actions taking are sometimes more visible to non-politicians or citizens than not. And interestingly, we find that more visibility, more transparency does not make them more generous than non-politicians. So that's a really interesting and counterintuitive finding, which means that we've got to be now a little bit more careful thinking about solutions to the problems we see in decentralization and local governance. This heterogeneity response suggests that one size does not fit all. This might differ across countries, even within countries in different parts of the country. Currently, India has very different local governments in different parts of India, different states in India, and we've got to be very careful about that. And we finally argue that effective policy requires evidence-based and contextualized tailoring initiatives to strengthen accountability and politician performance. So this is an example where behavioral economics is a very powerful tool to understand this, because this could not have been done in a situation where we had, say, a pure laboratory experiment. We did this experiment with actual politicians. And that's a big challenge, of course, and we could do it because we were able to mobilize local politicians in India in this particular setting. And I think the important thing here is to think about how can we use behavioral economics to answer quite difficult governance questions. And I think this example shows that it is possible, and maybe there are many other ways we can think about using behavioral economics to think about governance issues. Thank you.
Great, thank you for that, Kunal. Really interesting applications within one context. We can think about how it can relate to others as well. So really cool insights from behavioral economics application there. So, okay, we've seen a spectrum of presentations. So these are newer areas of application for behavioral science in the UN. So now we're going to go to our panel for remarks. So these colleagues are at the early stages of their journey, as I mentioned, thinking through behavioral science application. So I'm going to turn it over to Christelle from ICAO for a few comments on behavioral science in our organization and where things might be going.
Thank you so much, Mary, and good day to all. First, thank you for the invitation to speak about ICAO's journey on behavioral science, which actually started about a year ago with the preparations for the 2022 UN Behavioral Science Week. Maybe a few words first about ICAO. It's the International Civil Aviation Organization, so it's the UN specialized agency for international civil aviation. Our work our mandate is to develop standards and recommended practices to ensure the safe, efficient, secure, economically viable, and environmentally sustainable international civil aviation operations. And we also support our 193 member states with the implementation of these standards. So directly relevant to the discussion today is that ICAO is an organization of experts, of aviation experts. And whenever we come forward on a topic, and that is really part of our organizational culture, we do it with that expertise background. So we only usually, take the floor on topics that we master. So when we decided to engage in behavioral science, we had to take a different approach and accept to not come forward as an expert, but as a facilitator of a broader discussion on behavioral science in aviation. ICAO doesn't have dedicated resources on behavioral science, so we decided to raise awareness. So to tap into the existing knowledge that exists within the UN system, but also in the wider aviation community. And I have to acknowledge here the critical role of the UN Innovation Network Behavioral Science Group, as it really, brought that expertise way closer to our organization. And when raising awareness and developing awareness-raising activities, we decided to use case studies that were simple and that were familiar to the work of the aviation community, but that would also lend themselves to broader discussion and more forward-looking considerations. I will give you a very simple, I hope, example. It's related to stress management. So stress management in the cockpit. It's something that aviation experts have been looking at for a while. So we started from this application. And then we knew that several aviation research organizations had started to apply behavioral science knowledge to this topic of stress management in the cockpit. So it was a way to build that bridge between the new corpus of knowledge and the kind of more regular considerations and questions that people have on the matter. And why it is important is because we know that with the increased automation in the cockpit, then the behavioral science can add value to future reflections. So that's how we built that first case study. So the UN Behavioral Science Week last year was a stepping stone on our journey, and building on that, we did have a full session on behavioral science at our 2022 Innovation Fair. And this year in July, so from the 5th to the 7th, ICAO will hold a Global Aviation Gender Summit hosted by the government of Spain in Madrid. And we've decided again to promote the topic of behavioral science and to use case studies on how it can de-bias recruitment processes, as we know that aviation is a male-dominated sector. And again, we did that through the UN Behavioral Science Group, as Mary organized the session on that topic. So we're always trying to take advantage of that virtuous circle that is created by the group, and hopefully to broaden that circle. So this is our approach so far. Thank you very much.
Great, thank you so much, Christelle, and great to see and hear about all the impact of Behavioral Science Week last year and where things have headed. Thanks for that. We'll look forward to continuing to have more conversations and expand more in the future. Great. Okay, so there are a few questions coming through in the chat. Maybe take a second here to just say about the ones that are there. I know some of the colleagues are answering them already, so if you have put a question in, check them out. Next, over to Sonia from UNESCO. Great, thanks.
Hi, Mary. Hi, everyone. Thanks so much for inviting me to this great session. I've listened already to a few of the sessions, and I'm very excited about Behavioral Science Week. So I'm at UNESCO. I'm a program specialist at UNESCO. I work in early childhood learning, specifically early childhood learning. My expertise is really in how children learn and improving policies and practices, in particular around the curriculum and the pedagogy. And I see a lot of potential of the application of behavioral science to education. A few areas where I've heard also being talked about this week are around addressing social norms, for example, around sending girls to school or enrolling children in early childhood education and care, or keeping youth in school. There are some challenges around getting fathers' engagement in their children's learning and upbringing. So there's a lot of potential, but one of the areas where I think there that I am working on and where I see a lot of potential is around teachers and teaching practices. So, and I see potential of behavioral sciences coming in to help us address some of these challenges. So for example, the supply of teachers across the world is not great. We are short at the latest statistics, which were from a few years ago now, around 69 million teachers. This is worldwide, but the need is especially severe in Africa and in sub-Saharan Asia. And so behavioral sciences could come in to support us and countries to help attract new teachers to the profession. Now, it's not just a matter of attracting teachers, but it's also a matter of having gender diversity. The teaching profession is mainly female dominated. So we also need to think about changing social norms about what teaching is, and that it's also open to men and to a diverse population, including people with different genders and people with disabilities. And so we can see how social behavioral sciences can come in to address these social norms. The other issue is about how to get high achieving candidates into teaching. So teaching is seen as usually a very low status profession, mainly because it's mainly staffed by women. But it's actually a very challenging profession. And even when it is well paid in some rich countries, it is still very difficult to attract high achieving candidates to the profession who tend to go to other career paths because they do tend to be better paid. But again, the issue is that we need to change our social norms around teaching, and it's not just an issue of babysitting. It's not just a matter of something for women to do. It's actually a very challenging profession. It's very difficult to do. And once we can get that message out, that is very challenging, and that there is a lot of very, just the STEM subjects are very interesting to both men and women. And then I'm hoping to change those social norms. And the final thing I want to say about how to attract more candidates into the teaching profession is also about how to get teachers to change their practices. Oftentimes, teachers who are older have been trained with older practices that have been changed, that need to be changed, and even some stereotypes still persist. So for example, children of varying abilities, there's still the stereotype that they won't be able to learn. And so there's no need to really encourage them to learn, or there's no need to spend more time with them, or even children with disabilities in classrooms. There's still the stereotype that children with disabilities can't learn. So addressing these stereotypes or these social norms can help improve how teachers can work with children, and so that every child, regardless of their background or abilities, can at least achieve to their full potential. So at UNESCO, we haven't really done much with behavioral sciences, but we are, thanks to Mary, going to be having an awareness raising webinar at some point in the future, and hoping to bring what the UN is doing on behavioral sciences to our UNESCO colleagues, and then start to see how we can start to apply behavioral sciences applications to our work with teachers, but education more broadly.
Great, thanks for that, Sonia. Some really interesting and important areas of application, and looking forward to continuing discussions. Okay, Kat, over to you for DCO side.
Thanks. I'll try to keep it short because I'm last, but also because I'm a little bit under the weather if you can't hear. So keeping it brief. Firstly, thanks for having me. I'm the innovation person at the UN Development Coordination Office. Coordination is our middle name. We work a lot on UN reforms, and related to the previous speaker, it's kind of like, using the same metaphor, not teaching children, but teaching agencies to play better together and share and play more nicely and effectively and efficiently together. So definitely understand those challenges and how social norms kind of affect the way we think about problems and coming together to solve them. So I feel like, we've been talking within this UN BeSci group for a couple of years now, at least, about how to get started. So this is maybe the third year I'm talking about how to get started. And it goes back to, what we can observe on this call, right? Nobody here, with the exception of John, does behavioral science full time. We each do this either as a passion for the topic or as an innovation person. I only spend maybe 5 to 10% of my time on this, among other innovations. So human resources and expertise is a scarce resource in the system. The other thing that's scarce in the system is resources, financial resources to do these projects. We are not in DCO, at least, we're not a research institute. We don't have projects just around fundamental research and testing out these kinds of hypotheses. We don't even have, I'm an innovation person, but I don't have a lab or a team. It's not that kind of innovation. It's more like mainstreamed innovation in our policy and programming resources. So I don't have a big budget to do projects like this. And I don't have a dedicated group of people who only think about this, and I don't have access to behavioral science scientists. So how am I supposed to do behavioral science? And this is not an opportunity for me to complain. I actually think that, what could be useful is having more corporate resources. For example, I think a lot of us could admit to having to being the source of some sludge in some process or programming in our world. And do we have an instrument to help us make that visible and understand that better, so that we can already start improving the way we work in the processes we can most directly influence? Having each entity develop its own kind of sludge audit kind of instrument is very expensive. Could we not just have one that can be easily adapted to different mandates? For many years, we've held out the hope of having a fellow or some kind of expertise through an academic partnership, which we did try 1 year. I want to say we had a small budget, in the tens of thousands. Nothing to snuff at completely, but we looked specifically for these kinds of academics who have a research interest or passion project in our area of work. And it's not that we couldn't find them, it's because all we had to offer was a project. And those guys want to use your your use case, your field offices, for ongoing research. And so a 2-month kind of scoping around what does foresight mean for DCO, not that attractive unless there's some kind of commitment to follow through and continue to provide them data to work with. So that was also a little bit of a dead end. And I have to say that there are some examples that weren't discussed today, but there are examples out there of where we've brought in big, expensive BeSci consulting firms, and the results were like, meh, you know, not enough that we could pay for them to come and help us then implement them, because it still didn't build too much capacity, despite the amount of money that we spent on getting a team of scientists to help us. So then I'm thinking about what are the strategies to complement behavioral science. So I think user-centered design is a very close I don't know what you call it, design, practice, thinking, problem-solving toolkit that is founded on behavioral insights, and I think is within our reach of practice. I don't have a PhD in behavioral science, but I can get my hands on a UCD design toolkit and kind of already put into practice some of those insights. And then also just thinking about the complementary strategies to the UN 2.0 quintet of change that has been, you know, popping up, buzzing around everywhere. How can behavioral science influence those other work streams in which there are maybe more resources, like on digital or data? How do we kind of develop solutions that bring all of these capabilities together? Yeah, so let me stop there and turn it back to Mary. Thank you so much.
Great, thanks for that, Kat. I think this is a really helpful way to end this conversation of, you know, it's great to talk about raising awareness and we think about all these successful projects and we have all of that, but then what is it actually like to do this, particularly in organizations like DCO, where you have lots of, you know, lots of coordination across the UN and other spaces as well. And those are all very valid points that we've heard, not just from Kat, but from others across the UN too. So I'm going to now call everyone back to turn their cameras on, and we can have a bit of a discussion amongst ourselves, and as well as with the Q&A we've got from the audience. So I think most of you have answered most of the questions already, but what I might do is turn it over to each of you, if we can, the next 1 minute, to maybe speak to your question. So for instance, John, your question was about how would we think about changing habits more generally? So in 1 minute, what might you want to say about that topic?
Oh, wow. Okay, so habits are problematic because they are some of the most deeply entrenched behaviors that we have, to the point where there is basically zero conscious processing or choice involved in them. There's complete separation into the dorsolateral striatum for these kinds of habitual behavior patterns, and it completely bypasses all conscious processing. That means that we need to basically disrupt them and find some ways to either prevent them from happening, prevent that habitual sequence from even getting initiated, or find ways to actually constrain the available choices that people have to them. This seems more like environmental design, and it is, because environmental design is a crucial part of applied behavioral science. If none of these are available to you, you have to take a cumulative approach and look at what drivers of behavior exist in the most evolutionarily primitive parts of the brain. These primitive regions, we do not like to subvert them or countermand them because they typically are responsible for survival function as well, and our body does not want us to stop breathing or stop, regulating our heart. So drivers that are located in primitive brain regions are best for countermanding habit.
Okay, thank you for that, John. There's a lot around, talk about the one-time behavior change versus habit theory, and it's great to go back to the more neuroscience of it all. Okay, so now to Debbie. There are quite a few questions for you about your study with MIT that's in the chat if anyone wants to find that, or in the Q&A answered questions. I think there were also some others about the trusted messengers. How did you know who were trusted messengers, maybe who weren't? Maybe expanding upon that would be helpful. Thanks.
Yeah, absolutely. The trusted messengers. I think. That was for the UN. I think Verified was such a revolutionary campaign simply because we for the first time, at least, if you ask me, we actually we did research, we did our due diligence, we thought about different effective ways of reaching people, and who are these people who could help us effectively do that, the kind of partnerships that we had to form, the kind of people that we had to mobilize. So it was all very varied. I mean, we're talking about people who have connections with those communities that we're dealing with, and that was like the most important thing. And as in communications, that changes with every product, with every message, with every with everything that you're trying to do. So yes, so I think it will be a case-by-case basis as to how do you find these trusted messages. And just to, think about it, even in terms of common sense, it's, who would you want to hear from about vaccines? Who has your best interests at heart, and these kinds of questions. And I think a lot of research was also done with focus groups, with communities and surveys and so on, to find out, who would be most effective in helping to communicate our message.
Great, thanks for that. It's a lot around. We talk about the behavioral science methods of the diagnosis to figure out who the talking to people, the qualitative deep dive. There's also some interesting things about surprising validators, and how sometimes you might not be the person you expect as the trusted messenger. It could be totally that's why these methods exist and why we do them.
Exactly. And for the longest time, I feel like we keep going to celebrities, we keep going to these major influencers. Yes, they do have a great following, and they do have people who will listen to them. They have a lot of influence, but they're also a large part of populations that we're not catering to, who may not have access on social media, or so.
Yeah, exactly. There's a lot there to explore. This is a whole webinar in itself on trusted messengers and how we can determine who they are and what role they could play. Okay, so Kunal, over to you. So there are a couple of questions about just generally engaging with academia. Obviously behavioral science leverages a lot of academic concepts and ideas and methods. So particularly for colleagues in the UN who are thinking about engaging with academics, Kat raised a few questions about engaging with academics. What might you say to them in terms of starting out on the journey with academia? Any comments or suggestions?
Well, first of all, UNU is supposed to be the agency from the UN that's supposed to bridge academia and the UN's own work. So that's really what we're supposed to do. But I think the point really is that there's been such exciting work in academia on behavioral science that there is so much to draw from. And I'm sure the behavioral scientists in academia are very keen to engage the UN, because they can actually then put a lot of the ideas into practice as they work with different UN agencies. In my area, I'm an economist. Behavioral economics is the most exciting area there is in economics, right? If you see the Nobel laureates now that have been awarded in recent years, so many of them are behavioral economists, starting with Daniel Kahneman, Richard Thaler, and so on. So there is a lot to draw from in academia on behavioral science, and we in the UN should reach out to them, because we can learn a lot from what they're doing, and they can learn a lot by working with us in the UN. And I think it's really important to bring these two communities together, because both can contribute quite a bit. And I think that's something that perhaps particularly in the UNU, we should be doing a bit more about. Thanks.
Yeah, for sure. No, I will agree with all of that entirely. We can also talk about maybe more ways we can engage more with the UNU and the UN Behavioral Science Group to help make those linkages. And also, I definitely agree as an economist that behavioral economics is the most exciting space in economics. Lots there to explore. And it's amazing how the last 10 years, 15 years, how it's gone from 20 years, how it's gone from the sort of side on the fringe, and now it's becoming so much more common in mainstream. Nobel Prize winning, as you say. Okay, so I'll stop there. So maybe some quick comments and reflections back to Christelle. There's a question for you about how do you build, what challenges do you face building awareness? Maybe just briefly speak to some of those.
Sure. So the biggest challenges that that comes to mind is really our own lack of knowledge about what's happening out there. So in doing research this research, you realize there are more projects ongoing in aviation than you thought there would be. And linked to it is the scale-up issue. So similarly to Kat, I mean, we do not have, dedicated resources on behavioral science, so it makes it a little bit harder to have this kind of wide-ranging research project. And it's a matter of going one by one, learning from, say, oh yeah, we have an application here, an application there, but how do you bring that out to the wider community and scale it up so it does make a difference. So we're still struggling with this one. Probably, that's our work for the next 12 months. Thanks.
A very good point. I mean, we had a session earlier about embedding behavioral science, and even entities that have teams are still struggling with similar things. And all these issues never get completely resolved. Great. Okay, so now on to Sunny. There are a few questions about teachers in particular. Do you want to comment on some of the responses you made to those?
Yes, I think one was about changing social norms, which is what Christelle was just talking about, or she was talking about raising awareness, I think. So yeah, I mean, there's a lot in the literature already about social norms, but I think the difficulty is pulling that out and contextualizing it. And nobody's ever really thought about it, or as far as I know, nobody's ever really looked at it from the perspective of what the type of work that we do, which is essentially trying to recruit more teachers into the profession, in general, recruiting more men into the profession, making the profession appear as something as valued as medicine or law, which is a social norm we have to address. And that's worldwide, really, even in countries where teachers are well paid. There's this misconception about what teaching really is, but it's actually a very difficult and challenging career. And I think the more people understand what it is about, it will be more attractive. So how to change those social norms? I wish, like the others, there was enough funding to be able to implement an interesting study and better understand it. But I think it just needs to be investigated with financing.
Very important. These research questions should not only come from academia, but should come from the real world, certainly. So these are some important ones. Okay, now Kat, over to you. You raised a lot of interesting concepts and ideas. What would you say? My question to you is, what would you say to someone starting out, like Christelle, even before Christelle and Sonia, someone who's inspired by behavioral science this week, Behavioral Science Week, and wants to start on their journey? What would you, in short 30 seconds, what would you say to them?
Yeah, if I'm the expert on anything, it's starting up. I have many years of starting up. I mean, of course, like, don't give up. Keep your curiosity, right? And if you're passionate about it, find a way to follow it. But then look at the people around you. They're not likely behavioral scientists, but what does it mean to their work? And why should they care? What is the problem they're trying to solve? Think about it that way, and then try to bring what you know of the kind of resources out there, studies that have already been demonstrated effect or impact over many different sectors. Try to bring that in to your conversations. And about, like, I have a lot of people come to me when they have problems. So like, be a bit of the therapist and try to understand what is that. What is their problem boiled down to a set of behaviors that need to be changed or shifted? And I think that is a good way to kind of keep us grounded in the whatever part of the UN you work in, is that thinking about sort of the end user anyway. And like I said, I think that, I mean, while there's no resources for RCT gold standard trials out there for us in the future, there's a lot of handy material already out there. And so just try something. Over.
Great advice. And yeah, no, there's lots. You're so poised, Kat, to do something. You're saying all the right things. You're like on the verge of a project. So we'll continue this conversation after this call. But great. Thank you so much, everyone, for joining us and for this really packed session. We're sticking to time and being so efficient. This has been great. So we will share this recording on the YouTube playlist on the website and everything that we've shared previously. Thank you very much again, and looking forward to seeing you all hopefully over the next few days at some more Behavioral Science Week sessions.